Okay, think about this for a second. We manage our entire lives from our phones, right? Banking, travel, everything. So, why is our most important information, our health data, still stuck in dusty filing cabinets and scattered all over the place? Today, we're going to look at a much better way, a way to connect our health and pull it out of the past and into a truly connected digital future. You know the feeling, right? It's that constant headache. Your primary doctor has one set of files, that specialist you saw last year has another, and your latest lab results, yeah, they're probably buried in an email somewhere. This isn't just annoying, it's a seriously fragmented system that can create real gaps in your care. It's what we could call the healthcare maze. You're dealing with forgotten appointment times, lost lab results, and playing endless games of phone tag just to get a simple answer. And maybe worst of all, there are these huge communication gaps between the specialists who are supposed to be working together. It forces us to be reactive, always putting out fires because the system itself just isn't built to be efficient. I mean, come on, there has to be a better way. We absolutely need a secure, central place that can act as a bridge, seamlessly connecting patients, doctors, and the people who run the clinics. And this isn't just about making things easier, it's about completely rethinking our approach to healthcare from the ground up. And here's that transformation in a nutshell. You go from scattered information to a single, centralized platform. You move from communication gaps to actual, seamless collaboration. But the biggest shift, the real game changer, is going from reactive care, only dealing with problems after they happen, to proactive health management. That is the core promise of a system like HealthVault. So, where does a big change like this even begin? Well, it starts with the most important person in this whole equation, you, the patient. Let's dig into what it really means to take control of your own health journey. Just imagine having one single secure spot for all your vital health info, a place where you can see your personal metrics, keep track of your medications, schedule your appointments, and see your entire care team laid out in one place. You can even read up on your doctor's credentials. This isn't just about getting access to data, it's about giving you a genuine understanding of your own health. And getting there is designed to be incredibly straightforward. You log in, you click My Care Team, and boom, you instantly see the professionals who are managing your health. It's simple, it's direct, and it brings a whole new level of transparency. Of course, an empowered patient needs an empowered doctor. It's a two-way street. So now, let's flip the script and look at the other side of the coin, the doctor's dashboard, which is built to streamline how they deliver the best care possible. For doctors, this is all about efficiency and, frankly, sanity. They can forget digging through stacks of paper files. This is like a command center where they can manage all of their patients and track appointments. And here's the key. They can securely upload a lab report or a new prescription right to a patient's profile, and it shows up instantly. And the workflow for them is just as easy. A doctor logs in, goes to their patient list, and uploads the record. That one simple action closes that communication loop we talked about, making sure the patient's file is always complete and up to date. Okay, so we've seen the patient's view and the doctor's view, but who's making sure this whole digital ecosystem runs smoothly and, most importantly, securely? That's where the administrator comes in. Let's take a look at the high-level control panel that ties the whole system together. The administrator has that 30,000-foot view of everything. Their job is to oversee the entire platform, manage who has access, keep the lists of patients and doctors current, and enforce all the critical security rules that keep everyone's data safe. You could say they're the guardians of the system's integrity. And this really shows you the scale of that responsibility. Being able to search and manage hundreds of different records means the admin can supervise the whole platform, making sure the system that everyone relies on stays both secure and efficient. So we have these three totally distinct views, patient, doctor, and admin, all working in harmony on one single platform. But how does the system know who's who? How does it know what to show each person? Let's peek behind the curtain at the tech that makes this all possible. Well, the secret sauce is something called role-based routing. The best way to think of it is like a really smart security guard at a big building. When you log in, it checks your ID, your login info, and directs you to exactly the right floor, showing you only the information that's meant for you. It's what makes the system feel personal while keeping it incredibly secure. And the journey of a single medical record follows that same airtight logic. A doctor uploads a file, maybe a lab report. The system instantly knows what it is, tags it, and stores it securely.
And for the patient, that brand new record is immediately available to view. It's a direct, secure pipeline for information to flow exactly where it needs to. So, in the end, the entire mission really boils down to this one idea: bridging the gaps. It's all about replacing that fragmented, confusing old way of doing things with a system that is truly comprehensive, connected, and built for collaboration.
And that really brings us to the final thought. When you see how technology can streamline and secure our most personal information, the real question becomes, when is this going to be the standard for everybody? Is our healthcare system finally ready to leave the maze behind and step into a secure digital vault? Thanks for tuning in.